on AM 1100. The Flag.
Hey, look who walked in the door. It's our good buddy, Chad Zimmerman. Dr. Chad from the clinic, Family Health and Sports Chiropractic, joining us in studio here on the Need to Know Morning Show. And if you are anything like me, you had some little back discomfort after all this shoveling. My snowblower was in the shop for a few days at an untimely juncture.
Uh-oh.
And so, Dr. Chad, I'm going to get started. I've got a personal little story, and I want you to tell me if there's something I really need to worry about here, or if this is just one of those, laugh it off, a couple of beers, you'll be fine. So,
hey, Doc, it hurts when I do this.
Yeah, then don't do that.
There you go. There's your answer.
So I'm shoveling snow, and as you know, we had the heart attack snow, the real heavy stuff.
A Widowmaker.
The Widowmaker, yes. And then, of course, the wind came and blew it all down. So we had the heavy, wet snow all packed down by the wind. So it was really heavy shoveling stuff. So I'm shoveling. I try to, watch that you're not cranking your back too bad or being really goofy. But I was a little off balance, took a step, a little bit of shovel. And all of a sudden, I felt like something in my lower back, like way lower back, just sort of give. Like the elevator came crashing down about a floor or so. And it didn't hurt, but it just felt like some instability all of a sudden. And it kind of started to stiffen up a little bit. So I kept shoveling, just trying to work it out. I figured, well, it must just be one of those things that can loosen up over time. So what happened to me, and should I be worried?
Well, it can be hard. It can be hard to know just from a description like that. I think the two main things that you tend to see are joint instability, and that's due to the core muscles kind of letting go, right? Like when we stand up and we go to bend, a lot of those muscles shut off. And so if we're doing something strenuous like shoveling snow, sometimes that leads to that instability, and we can injure a joint or injure a muscle or something like that. The more serious thing that can happen is we can tear those little squishy discs between the bones, okay? And that's a whole different type of a thing. Usually you're going to feel a very sharp pain. Maybe your back goes into a spasm. It gets very tight, very vulnerable. Those kinds of things can develop into more serious things. And so what I generally tell people is give it a few days. Ice it for the first couple days. After that, put some heat on it. If things aren't noticeably better within a few days, then it's probably a good idea to go get checked just to make sure everything's okay.
Okay. So it got a little stiff on me. It was a little sore for a day or two, but it's pretty good now. I don't really notice too much, just a little stiffness maybe, but nothing too bad. But I'll come and see if there's issues going on later. Now, let me ask you though, if you do have that happen to you, and this would be a different sensation than I've really felt. Once in a while I feel a little ping or a zing or something like that, but this felt like some muscles just gave out or something like that. It seems to be better now, but if that happens once, is there an easier chance that it happens again? Like is a partial tear of something that could come back again sometime later?
I think the easy answer to that is yes. I mean, anytime you get pain, something got damaged, right? Our bodies heal, but our bodies never heal 100%. Then we always end up with scar tissue. Something always ends up, a little off as a result of that. And so anytime you damage yourself once, you're more likely to be susceptible to it. So particularly in the back, you want to make sure that you have good flexibility, but you also want to make sure that you have really good, strong core activation to protect those subtle and vulnerable movements.
And what are some other issues people are dealing with this time of year besides the shoveling? Slipping and falling on ice, I suppose, is always something that happens. I've had that trying to get into my car, and I slipped kind of under on the ice trying to get in.
We see an awful lot of shoulder issues this time of year for exactly from things like that. There's also the repetitive motions involved with shoveling where we have to get the snow and push it out front by raising our arms. And so we see an awful lot of shoulder impingement syndromes too. People come in, they're getting shoulder pain, usually in the front of the shoulder. A lot of times it hurts when they raise their arm.
Right.
Or they'll complain about it at night. They try to lay on that side and they'll get this kind of sharp pain in the front of the shoulder.
And how long does a treatment like that take in general? I know everyone's different, but if someone comes in fairly quick after the injury, how many treatments approximately?
Yeah, it does depend a little bit upon the nature of it, but most shoulder impingements have to do with the tendons, and they have to do with the tendons getting trapped up in the shoulder itself. And amazingly, within a lot of times 3 to 6 treatments, you can get people back to feeling normal again.
What about with New Year's resolutions now? People, I'm going to hit the gym, and they go there and they're all or nothing the first day or two. And then Hallstrom's one of those. So then they get hurt. What do you recommend as far as that?
I think people need to move into those routines slowly. Okay, what we tend to do is go back into our minds and think about what we used to do at the gym.
Yeah,
right?
exactly.
That we got out of habit of. And in that time frame, we've tightened and we've stiffened. And I think a lot of people really need to work on flexibility. I'm a huge fan of things like yoga.
Yes.
Because as we get older, it's the flexibility that we're fighting.
No question about it.
So I encourage people to spend at least 10 or 20 minutes at the gym every time they go, just working on flexibility.
You know, I did a hot yoga class recently, and I do yoga, but I've never done the hot. I thought I was going to die. I'm not used to the heat. It was like 95, 100 degrees in there. Is that really good for a person?
For certain things, I think it can be, but we live in North Dakota. We're not used to that.
Well, they made me sign a release form, I think, so I didn't have a heart attack and blame them. It's like, oh, you got to be kidding me. It was horrible hot.
Yeah, if you have to sign a waiver to exercise, then maybe that's not the right thing to be doing.
Hey, us old people, you need it warm to limber up and stretch out, because those old bones and muscles, they need a little something to definitely help the process. 8:12 on the Need to Know Morning Show, AM 1100 The Flag, WZFG. If you've got a question for Dr. Chad, you can call us at 701-271-1100, 701-271-1100, or you can send an email, studio@flagfamily.com. So, Chad, you were talking about shoulders, and I remember still you telling us that story about a woman that you talked to that didn't know you did shoulders. So there's always people that can be helped. But what are some of the situations where somebody might need surgery on a shoulder? They come in and say, hey, you got to, we're going to need to go under the knife or whatever, and you can help them out with something, just chiropractic to help it out. What are some common helps that you can give that way?
The only shoulder issues that you tend to run into that you can't really help are when people tear the labrum, which is kind of that cartilage up in the joint there. But most of what you see aren't labrum tears. They're rotator cuff issues. They're tendon issues, tendon tears, things like that. If a tendon's completely torn, it's detached, that needs surgical attention, okay? But short of that, most of them don't. If you just get in there and find those areas and work them the right way, a lot of times you can change those tendons. They just need a little help.
Yeah.
Okay. And what you tend to see happening is people end up with rotator cuff issues, and they get told to do a lot of strengthening.
Yeah.
And a lot of times it's not a strength issue. It's actually a structure issue of the tendons. And so if you do hands-on care and work the tendon and soften it and improve its flexibility, it stops getting impinged. But a lot of times that gets missed. And so people end up going through some sort of rehabilitation. It fails. Then they start getting the cortisone injections. And I really hesitate to tell people to go through with those, because if you read the data on cortisone almost always weakens the tissue further. Like if you inject that stuff into joints, it actually kills cartilage cells, which is really the reason why people are getting it in the first place, is because they have wear and tear in cartilage.
You hear about a lot of people getting it injected into their knees.
Into their knees, into their shoulders, into their backs, and it never strengthens anything. It always weakens things. And so you're trying to feel better so you can get by doing the things that you need to do every day, but you're robbing Peter to pay Paul.
What is the rotator cuff? What is that?
So the phrase rotator cuff refers specifically to 4 muscles that support the shoulder. Okay. So you have the supraspinatus, infraspinatus, subscapularis.
I was going to say that, but I figured I'd let you do it.
And the teres minor muscle. So it's the shoulder girdle. There's a lot of muscles, but those are the ones that they refer to as the rotator cuff. And one of those actually passes through the joint. And so when we raise our arm, if that tendon has thickened over time, we can start pinching it in the joint. But if you manipulate the joint and you soften the tendon, those issues go away without the cortisone, without the surgeries.
Well, I'm going to do the commercial here for you then, because we're at the time of year when a lot of kids that play baseball are going to start to kind of ramp up the activity a little bit, start some of that indoor work, and for pitchers especially. If you're talking about, Chad, that there's things you can do just to manipulate that area to strengthen, get there, supple it up, whatever you do, this would be a great time to stop by and visit the sports chiropractic arm of the company. Yes.
Oh yeah, I think any baseball player that goes through the tens of thousands, hundreds of thousands of repetitions throwing that ball overhand is at risk for developing that.
Yeah.
I tore mine 19 years ago, and it was just due to, wasn't that I did anything different. I did the same thing I'd done for years and years, but my shoulder had changed. And those things, you can actually pick up on those things before the injuries ever happen and correct it so that it doesn't happen.
So I'm guessing people have surgery, and later on, like someone like you takes a look at it and says, you wouldn't have needed to have surgery. How many of those surgeries out of 100 do you think are preventable?
About 95.
What?
Yeah. There was a study.
Hang on just a minute. You're saying 95% of shoulder surgeries could have been helped with chiropractic care?
Of the impingement syndromes, yeah. There was actually a study maybe a year ago, and I think it was the British Medical Journal, which is a very good one. And they looked at impingement syndromes, and they split them up into two groups. One group got surgery, the other group didn't have surgery.
Yeah.
And the long-term outcome was the same for both groups.
No kidding.
Yeah.
Wow. Interesting stuff there. So how do you know, if you should kind of let that shoulder injury just kind of work? I mean, we all, shoveling snow, whatever you're doing this time of year, you slip and you fall on something. How do we know when we should get it looked at, and how do we know just to give it a little bit of time?
When it doesn't go away. So if you're dealing with something and it's gone on for a few weeks or more, chances are it's not going to go away. And so the sooner you get it looked at, the sooner you get the right type of treatment, the faster it is to fix.
Yeah.
But a lot of times people kind of wait and wait and wait and wait. And a lot of people come in and it's 4 to 6 months or more that they've been dealing with this. So don't hesitate. It doesn't have to be expensive to fix, but the longer people wait, the more expensive it's going to get.
Good stuff. If people want to find out more about your operation and how you can, how they can get some help from you, how do they find you?
Easiest thing to do really nowadays is to look us up online. It's wfsportscare.com. We're located at 1207 Prairie Parkway, which is over in West Fargo, about a block from JL Beers off of 13th.
wfsportscare.com.
Yep.
Very good, sir. Always good to see you, my friend. Thanks very much.
Good to see you guys, too.
Happy New Year to you and everybody over at the clinic.